On today's World Insight, momentum for international vaccine cooperation with China's aid pledge of a couple of billion vaccine doses this year, besides funding for COVAX. Can it start the ball rolling on world solidarity against the pandemic? And national security in the shadow of a variant-fueled pandemic and threats to digital security. How can China steer through choppy waters? Advice from an international relations expert.
The challenges of which are unprecedented.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei from Beijing on CGTN. China has pledged to hand out 2 billion doses of COVID-19 vaccines for the world and help the vaccine alliance COVAX with $100 million, all delivered throughout this year. Chinese President Xi Jinping made that aid public in a written message at the first meeting of the International Forum for COVID-19 Vaccine Cooperation. Xi said that he looked forward to seeing the forum take new steps for equitable global access to vaccines, strengthening solidarity and cooperation among developing countries, and working together against the pandemic. Taking part in the forum are ministers from other countries, representatives of some international organizations, and businesses. So how can the international community better cooperate on vaccines to curb the pandemic? Let's loop in our panelists. For more, I'm joined by two panelists in Seattle, Dr. Alice Kim-Kyung-Tan, internist at Ms. Medi Women's Hospital from South Korea. Good to see you, ma'am. And in Beijing via Skype, Ding Sheng Din from the School of Pharmaceutical Sciences with Tsinghua University. Good to see you, Professor. Let me start by asking both of you about the latest forum. 2 billion doses contributed by China for the rest of the year, and also about $100 million to COVAX. How much a deal is it in terms of its support to the global fight against the pandemic? Mr. Ding.
Yeah, I think the announcement made by President Xi today about these 2 billion doses of vaccine and also 100 million donations actually are very significant. Certainly, this is just for this year. I certainly think in the future, China will continue to make such contribution to the global anti-COVID-19 fight.
Dr. Tan, we know that COVAX is behind its schedule due to many reasons. There were countries that are putting preconditions to their previously earlier agreed pledges, for example. There's also issues of not enough manufacturing due to outbreaks in different countries, including in India. Dr. Tan, how much do you see those pledges could at least of some support to the global fight?
Of course, every drop counts. Right now, the WHO has a goal of vaccinating 40% of the world's population by the end of 2021, 60 to 70% of the world's population by mid-2022. But this goal right now seems almost unattainable given the deficit in funds and also in doses. So this huge donation proposed by China will really help in terms of garnering support and also the practical matters of funds and doses.
As you said, that there were earlier plans. If those plans are not being met, I mean the plans made by WHO as a pledge for everyone in the world, what would that mean in terms of the global capability of fighting against COVID-19? As we know, the longer we drag on, more variants will come out, more outbreaks of different waves will come out. Dr. Tan.
Absolutely. So unfortunately, what we're seeing right now in terms of the epidemiology, the forecast in the near future does not look bright. Right now, for the last month, there has been an increase in daily new cases. And also, there are many regions of the world that are seeing increase in deaths as well. And of course, this is fueled by the Delta variant. So as you very rightly pointed out, every day that this is dragged on because of inequitable vaccine distribution, there's just going to be more and more spread of the Delta variant. And also, we should not forget that the environment is ripe in some countries for the emergence of an even more virulent or perhaps even more vaccine resistant virus. And of course, that would be a huge setback to the world. And so any investment that we make right now, I think the IMF is asking for $50 billion US, that will offset the trillions of dollars that could potentially be lost if the pandemic is allowed to drag on.
Dr. Ding, your take.
Yeah, I think certainly having this forum and also open channels actually for the global community is very important. So far, in a very practical manner, actually, manufacturing, contribution to the COVAX as well as distributions, really delivering all the vaccines to the needed country actually has been certainly delayed. But actually having such high-level discussion forum, and also actually international different body of organizations actually really talking and focusing on actually deliverable execution would really help for the next stage of this pandemic.
As both of you know very well, what we're facing right now is the new variant, the Delta variant, that is influencing China right now, beginning from May, some could argue, from Guangdong, for example. And that's also having a huge impact in South Korea, where you, Dr. Tan, are originally coming from, even though now you are living in Seattle. So how should we understand, the latest numbers in the United States it's also, once again, skyrocketing in other parts of the world, not to mention. So how should we understand the paramount crisis that is coming, and probably even more to come in the near future, Dr. Tan?
Well, Dr. Rochelle Walensky of the CDC has said that we are dealing with a pandemic of the unvaccinated right now, and that's what we're seeing in the United States. And also, unfortunately, in Korea, because Korea has a relatively low vaccination rate of 15% of the total population has been fully vaccinated. And with the Delta variant, this is really a game changer. The basic reproductive number of this variant is between 5 and 8. That means one person can potentially infect 5 to 8 other people. And that's more than double the reproductive number of what we had in the very beginning of the pandemic. And so it really doesn't make sense for countries to even think about easing measures when the Delta variant is circulating. But of course, that's what many countries are doing, unfortunately. And I think the UK is a good example. They were seeing a rise in cases. They decided to ease all of their measures. And unfortunately, they are seeing an uptick in deaths due to COVID again. And the biggest threat, I think, right now is to all of the children of the world. Fortunately, the first wave, the first round of COVID-19 pandemic did not take as big a toll on children, but we are hearing anecdotal stories from pediatric hospitals, children's hospitals in the United States, where pediatricians are seeing that they are seeing ICUs now fill up with children on ventilators due to COVID-19 because of the Delta variant. And almost all of the children of the world are vulnerable to this variant. And so it is of paramount importance that everyone either continue all of the non-pharmaceutical interventions that we've been doing up until now, or get vaccinated, and I would suggest both.
And also we are joined now by Dr. Kate Tulenko, who is the CEO of Corvus Health. Dr. Tulenko, good to see you again. It's wonderful to see you several times during the same months, but it also means that we are gathering to discuss very urgent matters. We are talking about the Delta variant and its tremendous impact on the situation right now to the world. You are based in the U.S. Tell me more about the latest.
So unfortunately in the U.S. we are seeing rising cases, and 80% or more of most new cases are the Delta variant. And as your previous guest said, we're seeing more children getting sicker. The saying now is younger, sicker, quicker. That in the past, with the past waves, it's mainly been older people, more vulnerable people, but now we're seeing people in their 20s, 30s be very ill. So that's why it's important that everyone who can get vaccinated, everyone 12 and older in the U.S. should be vaccinated.
And also, on the other hand, there is still reluctance to be vaccinated. Meanwhile, there's also lack of equitable distribution of the vaccines, and at the same time, not sufficient manufacturing of vaccine. We are seeing really different layers of questions all piled up right now. The earlier ones not solved, and the newer ones are not having solutions. Dr. Tulenko.
Yes, I mean, there are a number of different things to unpack there. Regarding, cooperation, I think we need to move beyond cooperation being defined as wealthy countries giving vaccines to low-income countries, and look at cooperation as increasing the capacity of low and middle-income countries to actually design and manufacture their own vaccines. And we know today that the Chinese government is holding a forum for cooperation on vaccines, and we won't be able to judge the success of that meeting today, because at all these types of meetings people pledge billions of dollars and they don't necessarily come through. I think in 6 months or a year from now we can see what resulted from this meeting and know whether or not it was successful. Another area I would like to see more money put into is the creation of new antivirals, because the anti-vaxxers, part of the reason they don't want to get vaccines is they say, I'm not sick, why should I put something in my body? But once they're sick, they usually will accept medicines. And we really still don't have very good medicines that target the virus directly.
Those points, I think Dr. Ding is very much in a good position to respond. First of all, the impact of the meeting today. We've seen many meetings over the past year or so, international ones. We see also countries pledging, but also countries putting preconditions on their pledge later. And we also see lack of manufacturing, as we said earlier, because of the latest situation of pandemic in India, that would not be able to contribute as much as possible, which is understandable. But Dr. Ding, how do you see the several different layers of issues that I mentioned earlier? Dr. Ding.
Yeah, certainly it is very complex, but I would say certainly having actually such forum dialogue actually among international bodies, especially at the highest level, actually would be useful. And then it's really about actually how all of us can work together on the execution side. In terms of manufacturing, I would say actually in China as well as in other developed countries like U.S. Or other major developed countries, the manufacturing capacity actually are there. Certainly, ramping up the manufacturing would not be a significant issue, given all the expertise, all the people actually trained on such manufacturing. I think it's just a matter of having the fund and also actually really deliver on those different promises.
We have been talking a lot about lack of international leadership, global leadership at this most critical time when it's urgently needed. But before we go to that area, Dr. Ding, I also want you to talk about the antiviral, because you've been together with your colleagues at Tsinghua University and working with your colleagues around the world, trying to come up with the right types of antiviral for the COVID-19, and also contributing to the research of the latest vaccines. Tell me more about the latest development from an expert's perspective.
Yeah, certainly the antiviral approach, actually therapeutics, would very much be useful. Again, the existing actually antiviral, for example, the remdesivir, it's actually an IV drug. It's not very convenient for early access for patients. So that's why actually it's currently in urgent needs, especially in the context of Delta variant, which is spreads very fast. Early access to antiviral, even prophylactic use of antiviral therapeutics actually is so important. So that's why we and others, many other actually international biopharma companies actually have been really working hard on oral antiviral drugs. Several of those actually are being developed. We expect to have one actually nominated for early trials towards end of this year or early next year. Certainly, we already know Pfizer has one in phase 1 oral antiviral drug, and also very recently, Regeneron have actually one of their antibodies as subcutaneous actually injection approved for prophylactic use in individual exposed to virus. Certainly, antibody is still very expensive to manufacturing,
Right.
but having this subcutaneous version actually in the prophylactic setting actually is also an example of such utility.
I understand the Sinopharm has also recently announced that they have discovered some kinds of antiviral that might be helpful in terms of dealing with the Delta variant, but of course it is still an ongoing process, Dr. Ding.
Absolutely. For actually those variants, I wouldn't be very concerned, especially for small molecule antiviral drugs, because actually those small molecule antiviral drugs against actually different targets actually of viral replication, those have not been reported with actually mutations.
Now we know, Dr. Tan, that from now until the possible vaccine targeting or be able to better target Delta variant would only come into the market, hopefully, by the end of this year, early next year, for the earliest, which means from now until then, all we can do is better prevention and control. That's the only way we have. Otherwise, we go to herd immunity, which is, of course, the worst scenario if it's not by vaccines. So, Dr. Tan, we've been talking about this for more than a year, but ultimately, fundamentally, there are ways that we can do to prevent and control among the bigger population. I want you to repeat those important messages, first of all, and then help us to understand why don't just countries, localities, cities, people do it. This is beyond my explanation. Please help us to understand.
Right, so as you correctly pointed out, COVID-19, even with the Delta variant, is still largely a preventable disease. There are proven ways that we can keep COVID-19 in check. And we've been trying to get our public educated and on board with following these measures from the beginning: universal masking, hand hygiene, ventilation of indoor spaces, keeping your distance, avoiding crowds, testing early if you have any suspicion, the implementation of routine surveillance testing in high-risk venues. These are all measures that have been used successfully by many communities and countries around the world. The problem is some people, they don't recognize the need for them. Other countries, everyone is tired, and I think prematurely they're wanting to avoid using these measures, or prematurely they think that the coast is clear and their vaccination rates are high enough. But recently the CDC here in the United States, they reported a huge outbreak that occurred in Massachusetts, in Barnstable County, where there is a cluster of close to 1,000 cases, proven cases now, that happened in early July. And they were mostly of the Delta variant, and 3/4 of these cases had been vaccinated. And really the telltale lesson here is that even though the state of Massachusetts had a full vaccination rate of 69% of adults, that wasn't enough. With what's going on, we need to continue with all of the social measures and the public health measures on top of trying to vaccinate as many people as quickly as possible.
I understand, Dr. Tulenko, that in the U.S., there are still more than 40% of those staff working in senior care house, for example, that have not been vaccinated or do not want to be vaccinated. And now I know there are some enforcement by some of those centers. Do you see these kinds of executive, or shall I say, administrative measures would eventually work?
I think they will, and I think we'll see more of them. Probably by September, Pfizer will receive the full authorization for their vaccine, so it will no longer be an emergency authorization. And I think when that is the case, many nursing homes or continuing care homes will require their staff to be vaccinated, because by then it won't be an unproven thing. It'll be something that has full authorization. We know that the U.S. federal government is going to give all of its employees to be either the option of either being tested weekly or getting the vaccine. I think we will see many other employers do similar things.
China, Dr. Ding, has been able to have 1.7 billion doses being inoculated over the past 1 year. So what would that mean to the possible herd immunity in the population, if you could help us to understand better?
Yeah, I think we're just about over 50% being vaccinated. I think to reach the herd immunity actually will require much higher percentage of population being vaccinated. I think actually vaccine is still the most effective measurements to this virus. As others have already said, actually other measurements, wearing masks, social distancing, surveillance, contact tracing, those would also help. But on the other hand, I have to say, given over sort of 16 months, 18 months actually in this pandemic, I think at the global level, especially in many countries, vaccine, actually pushing a vaccine actually is still more effective, because other measurements actually are becoming less and less sort of enforceable. Although actually we know, like in U.S., in other countries, indoor wearing masks and other policies actually came back, but certainly we'll see more pushback to that. But vaccine, again, I want to emphasize actually vaccine actually really works even in the context of Delta.
I see.
Certainly we see more surges, but actually it still prevent severe and also death to significant degree.
Finally, before we go, since our topic today is about that specific conference on vaccines, how much do you see international cooperation should really work in this regard? I know it makes sense, but still, it's so hard to get one sentence from every one of you before we go. Let's go with you, Dr. Tulenko.
Well, I think we certainly see China using global health diplomacy, or what's often called soft power, in organizing this. And I hope, 1 year from now, we will see a world that has a more distributed, fairer system of actually producing vaccines.
Dr. Tan.
I don't never have too much cooperation, but there are multiple platforms right now for international cooperation. There's a task force in which the WTO, the World Trade Organization, WHO, World Bank Group, and IMF, they're all on board and trying to come up with a plan forward and have everyone on board. I think we should have a cohesiveness between the international groups and the platforms, because this is a global issue and we need cooperation on a large scale.
1 + 1 hopefully is bigger than 2, right? As you said. Dr. Ding, before we go.
Yes.
Yeah, certainly China playing such leadership role is actually very useful. In such situation, we really want to have someone to lead. Certainly more is better, certainly with already 700 million doses committed, distributed, as well as more actually coming to play. I think having this leading role actually would play an important part.
All right. Ding Sheng, Alice Kim Kyung Tan, K2 Lanko, thank you so much for every one of you. Really appreciate it, and be safe. You're watching World Insight with me, Tian Wei.